Here's all you need to know about face coverings. All hospital staff, outpatients and visitors must also keep their nose and mouth concealed. How a face mask could ward off the coronavirus. The World Health Organization, WHO, recommends face coverings be worn in public places where maintaining a 2-meter (6.5 feet) social distance is not possible. It previously claimed there was no evidence a mask or similar fabric barrier wards off a viral respiratory infection, like the coronavirus. There is evidence, however, people with an airway virus who wear a mask are less likely to pass it on. According to the WHO, new information suggests coverings may provide a barrier for potentially infectious droplets. The coronavirus mainly spreads face-to-face viral infected droplets expelled in a cough or sneeze. These may be inhaled or fall onto surfaces where they could be picked up by a person's hands. Those with mild or no symptoms are also thought to be capable of transmitting the coronavirus. Hospital staff are also unable to socially distance from the coronavirus-positive patients they treat. Being in a confined space with several sufferers may also increase the workers' viral load, the quantity of virus particles they are exposed to, leading to a more severe infection. While coverings and masks may be somewhat effective, the WHO has stressed they alone are insufficient to provide an adequate level of protection, and other measures should also be adopted, like regular hand washing. Experts have expressed mixed opinions of the benefits of mandatory face coverings. Dr. Antonio Lazzarino from University College London previously said people will continue to touch their face with potentially contaminated hands. Therefore, instead of helping us contain the virus, face coverings may just help the virus spread across the world. Professor Trish Greenhalgh from the University of Oxford argued, "The science on this is clear. COVID-19, the respiratory disease caused by the coronavirus, is most commonly transmitted by droplets emitted when we cough, sneeze, shout, sing and even just breathe in close proximity to others. We can't stay behind our front doors forever, and nobody wants a second wave of COVID-19, so covering our faces will become the new normal in public places, workplaces and on public transport. Who has to wear a face covering on public transport? To coincide with the gradual easing of lockdown, the majority of people traveling on public transport must wear a face covering. All are being urged to work from home if they can. Children going back to school, and the opening of non-essential shops means transport use is expected to increase. Experts have warned adherence to wearing a covering or mask is important for them to be effective, with many finding them uncomfortable. People are permitted to remove the covering if it is reasonably necessary for them to eat or drink. Coverings must only be worn on the bus or tube itself, not in the waiting area. Train passengers will be asked to cover their face when entering the station. However, school transport, cruise ships, taxis and private hire vehicles are excluded from the rules. All are introduced to no mask, no ride policy. Failure to follow the rules could result in refused travel, or even a fine, as a last resort. Are face coverings mandatory in shops? Despite being confined spaces, face coverings or masks are not mandatory for staff or customers. Retailers are required to introduce plastic screens at the tills and floor markings to keep shoppers 2 meters apart. Customers are also being asked not to touch items they do not intend to buy. Who has to wear a face mask in hospital? All hospital visitors and outpatients are being told to wear a face covering, which can be provided by the hospital if needed. Nobody will be denied care for failing to wear one. However, the ultimate decision on seeing loved ones comes down to the individual trust. Health staff already had to wear medical-grade masks in clinical areas within 2 meter (6.5 feet) of a patient, with this being expanded to all times in all places where to buy a face covering. Government officials have specified passengers are to wear coverings, not masks. A medical mask is scratchy and uncomfortable, and isn't designed to be kept on all day, Professor Greenhalgh previously said. Medical masks are recommended, however, for those over 60 or people with underlying health issues. People with coronavirus symptoms, fever, cough, and loss of taste or smell, and those caring for them are also advised to use this extra protection. for everyone else. The WHO recommends a fabric covering of at least 3 layers of different material. Official guidance states one can be homemade out of an old t-shirt. Thanks for watching. For more help, touch the links below. Feel free to subscribe for further assistance.